Hi, everybody. This is Cindy Kennedy, and you are listening to another episode of Living with Lyme. We're going to hear a lot today about Hyperbaric O2, and we're going to find out how it works and what it can do for people healing from chronic illness. I have Ryan Brinkerhoff with me here today, and he's the owner and creator of Inside Out Hyperbaric and Wellness. And he's all the way out in St. George, Utah. He focuses a lot on regenerative health. He has been studying and has several patents. And he's going to tell us why he got into this arena and why hyperbaric is so important to healing. Hi, Ryan. How are you?
I'm doing great. How are you?
I'm doing good. I'm doing good. So, everybody gets into their arenas either by chance, by being unlucky, maybe. I don't know. How did this come about in your life?
Well, in 2009, I had a major concussion, and just a spiral of different symptoms came out of it. Up until then, I'd had little weird symptoms here and there that, doctors had played off as this or that or the other. Nobody really had any answers for it. And then when this concussion happened, it took my quality of life almost to a zero. So immediately, after following the concussion, all sorts of different disease processes set in. I got diagnosed from everything from fibromyalgia. I developed a few different GI issues. I had this joint pain that would migrate from one joint to the next, swollen, hot. Extreme brain fog, to the point where conversation wasn't really anything I could do anymore. It literally, like, my brain would turn off right when I was speaking with somebody. There was, and then some major symptoms set in. So some psychiatric stuff started happening. I started having grand mal seizures, and then things got really scary when I started exhibiting symptoms of MS, as well as symptoms of ALS. This was a really scary situation for our family because just a few years prior, I'd lost two uncles to ALS. One was 41, the other one was 39 years old. And, we all sat back and watched how that not only destroyed them, but what it did to their families as well in the aftermath, after they were gone. And so it really became a dire situation. And that's when I, busted out my old microscope, started going back over to the microbiology lab, looking at, my saliva, my blood, and really digging in to try to find out what was really going on. And through that, I, discovered what looked like spirochetal bacteria in my blood, but every test I would get done at the hospital would come back negative. And that's so when I jumped on the net, started digging into the research. I attended an ILADS conference. I think it was in 2012, if I'm not mistaken, down in San Diego. And, through that process, I got so much information, found out about, labs like Hygienics where they could really find these bugs. And then I got my positive diagnosis with Lyme's disease. And ever since then, it's just been an ongoing study session trying to figure out how to unlock the secrets of these microbes and why they make us so sick.
Yeah, and this is how you became, an expert in this field and how to treat Lyme disease, at least a portion of how to treat Lyme disease. But it's really nice because you have physicians and other practitioners that refer people to you. So they really must see the benefit of your treatment strategy. So tell me, let's go to the simple fact here. What is Hyperbaric O2?
Okay, so hyperbaric oxygen therapy is it's a non-invasive procedure that people go through. You basically get inside a pressurized chamber and you breathe between 92 and 100% oxygen, depending on where you're at. And the reason why this is so important for folks that are dealing with really any chronic illness is, number one, the major anti-inflammatory effects of hyperbaric oxygen therapy. Professional athletes are living in these things these days, basically because they beat up their muscles, their tendons, their bones hurt. they're bruised up, they get in a hyperbaric environment, and it takes that inflammation from a 10 down to a 2, and then they're able to go back out on the field and do what they do again. Well, the same thing is true for folks that are suffering with chronic disease. In all these chronic diseases, we all know that inflammation is one of the biggest problems that we deal with. And so you get in that hyperbaric environment, and instead of dulling the inflammation like NSAIDs or other type of pain relievers, hyperbaric oxygen therapy goes in and it down regulates the cytokines that turn on all the inflammation. So it's going farther ahead than the pain pills and the NSAIDs and saying, body, calm down. We don't need to do this right now. Let's bring that inflammation level down. So that's probably the most important way that it helps chronically ill folks.
Well, it's been around a long time. I mean, this is something that has helped burn victims and people with terrible ulcers heal.
Right. Yeah. Oxygen is the most important molecule, not only to sustain life, but also for healing. And so when you're in a hyperbaric environment, you get about 700 to 800 times the amount of oxygen that you would normally have inside of your plasma. And it really floods into the fluids of the body. That's where it's different. People say, well, can I put on a mask and just breathe pressurized oxygen and get the same effect? And it doesn't do the same thing. In a hyperbaric environment, it literally forces the oxygen down into the fluids of your body. So not only the plasma, but your cerebral spinal fluids as well. And the best way to think about it is carbonated water. You have water, you put it under pressure with CO2, and it forces the CO2 down into the water. That's what hyperbaric oxygen therapy does but with oxygen.
So it's not just as you breathe it, it's actually through your tissue.
Yeah, through your tissue, and then forcing it into the plasma and the other fluids. And that's where some of the major effects happen. One of the coolest things about hyperbaric oxygen therapy, and they just barely figured this out about 3 or 4 years ago, is that circulating stem cells in your system go up 8-fold. So whether you're doing stem cell therapy or if it's nothing you've ever done, when you're in a hyperbaric environment, those cells that can literally go in and become whatever they need to become to repair the body go up 8-fold. So that's why we see such fast healing in our clinic here, with everything from extreme autoimmune diseases to somebody just got a non-healing wound. That's really how it does. The oxygen helps repair the tissues, helps you regrow collagen, connective tissues, things like that. But it's also the stem cells that get released in your body when you're in a hyperbaric environment that really start to rebuild.
So how do the stem cells know where they're needed? I've always wondered that.
Yeah, it's really interesting too, because we do stem cell therapy here at my clinic. And when we go, localize, well, of course, the stem cells are going right in where they need. But when you go IV stem cells, it's got to be something to do with that innate intelligence that we have inside of us that controls our system. Because if we have somebody that is suffering, from poor kidney function, or we have somebody that's got lung issues, magically the stem cells end up in the area where they're needed and they start to do their job.
Yeah, I like that. I like that idea. It seems so simple, but it is so complex at the same time. Now, how long is a session in the chamber?
We start out at an hour, and then we slowly move folks up to 90 minutes, because that stem cell production and mobilization that I just talked about happens between the 45 and 90 minute mark. We call it the little Goldilocks zone. So we like to keep people in that zone as long as we can, but we can't rush too quickly to get there.
Okay. How long are the effects following a session?
So the half-life on the huge dose of oxygen is only about 8 hours, but the tissue repair, the downregulation of inflammation, and some of the other great things it does can stay for weeks on end. So it really just depends on the individual, and then also how many sessions you've done. There's a very compounding effect, like with a lot of treatments, that if you can do it every day for an extended period of time, your body goes, okay, central nervous system, we've got all this fuel for you, which oxygen runs the central nervous system. We need to start, instead of just keeping the heart beating, the brain functioning, the lungs working, let's start fixing all these things that we've just kind of not dealt with for a long time because we didn't have this fuel available to us.
How often do people, I mean, it's probably not easy to come in every day, but do people actually do that?
Yeah, we have folks coming in here to our office on a daily basis. And then we also have a rental program, and we also sell a lot of these chambers. So for folks who are in a really chronic situation, usually the rental, if they can't afford to buy one, is where we go. So that way they can do a morning and an evening session. And in the duration of a month, they're able to get about 60 sessions in. And usually 40 to 60 sessions is where you'll see the major healing happen in the body. Usually after 2 or 3 sessions, you'll start to notice little symptoms start to disappear. But for very chronic situations, that 40 to 60 session range is where the lights really start to come on and the body shines.
So after that, are you golden, or are we going to see some setbacks, or is that dependent on each individual?
You know, what we do is it's very individual dependent, right? And then it's also dependent on how the individual takes care of themselves and their genetics. You know, you'll always have those folks that'll walk in with their 120 ounce, Coke can, their refill mug, suck that down, get in a chamber. Oh, I feel great. And then they'll go right down the street, fill that up again. And now the effects are starting to disappear. We're trying to take away inflammation. We're trying to downregulate sugars, but then they go, to that area. And then genetics plays a role, but it really just depends on the individual and really what they're trying to heal up. One of the best models that we have so far is for traumatic brain injuries. So when I was growing up in small town Utah, we're always told you have X amount of brain cells, and if you damage them, you're just out of luck, right? That was always what was held over our head to try to keep us from being bad kids, right? Well, right? Was that how it was where you were from?
Well, no, I don't think I've ever heard that, but I used to think
Really?
as a youngster that people who were drinking a lot of alcohol were just, messing up their brain, and that wasn't able to regenerate.
Right. Yeah. And that was always the, kind of the sentiment that we had at the time. But because of, pioneers like Dr. Hark down in New Orleans or Dr. Amen here on the West Coast, they're starting to use SPECT scan imagery and do SPECT scans of the brain before and then SPECT scans of the brain after hyperbaric oxygen therapy. And you can literally see areas of the brain where there was no blood flow and the neurons were not firing. They start to come back online after you get through X amount of hyperbaric sessions. So, there's this huge push right now with Dr. Amen in California to anybody that suffers traumatic brain injuries needs to be in a hyperbaric environment. We need to turn on those areas of brain that have been damaged. And so these people can go back to living and functioning in the normal world instead of, oh, let's lob this pill at this person and hopefully it works. Let's try this antipsychotic. No, let's go take pictures of the brain first, find out what's not working, supplement around those areas, and then let's use a catalyst like hyperbaric oxygen therapy and start to rebuild those. It's called neurogenesis, where your body starts to produce new neurons. That's the probably the second best thing hyperbaric oxygen therapy does. Literally new neuron growth in damaged areas in the body.
It sounds like the National Football League and the American Football League, they need to have a few of these right where they are, because we know a lot about traumatic brain injuries with that group of people. First I'm going to ask you, is it not for everyone? Is there anyone that should not receive hyperbaric O2 treatment?
Yeah, so the folks that are claustrophobic, it's very hard for these individuals because you are in a confined space. Even though you can let yourself out anytime you'd like, there's still that fear that, oh no, they're going to put me in here and everything's going to disappear outside and I'm going to die in here. Those are the patients that we have the hardest times with. Even though, it's not like an MRI where it's sitting right on top of your face. Our chambers are 34 to 40 inches in diameter, so there's a lot of room in there. Some claustrophobic people still have really big problems with them. Other folks that have problems with their antioxidant systems in their body, which, people that are suffering from MSIDS and, chronic mold illness and things like that, you got to be very careful with them. So most of our patients, when they first come in, they get put on an antioxidant regimen while we're doing this, just in case they have those genetic problems that we're not aware of. And then the other group that will respond, it seems negative at first, but then over time they really start to turn it on, is of course our folks that have Lyme and all these underlying co-infections, right? Because most of the bad bugs that make us sick are what they call anaerobic, which means they don't like oxygen. So you throw somebody in a hyperbaric chamber that's suffering from, these Lyme and co-infections, you're going to have a major die-off if you go too quickly. And if you're not supporting, the detox processes in their body, using binders, making sure the liver's working fine, kidneys, then they're going to start backing up, and they're going to have a major Herxheimer reaction. So you have to be very careful when you first start working with folks in those aspects.
So this is more of a treatment for someone who has possibly been misdiagnosed or incorrectly treated, and the spirochetes are no longer in, the tissue form. It's spread into the body. That's
right.
What we're dealing with here. And certainly those that form biofilms or in the different forms, the L form.
Right.
What's the difference being, more advanced versus less advanced? Or even, I assume that we really rely on our immune system to take care of us. But then people go on, we know people that have had Lyme for years. They're undiagnosed, but they may not be having symptoms. But then something happens, like a trauma, like a head trauma, like a death, a loss of job, a divorce, whatever the case may be. And then boom. So what would you like to tell people about getting a correct diagnosis and getting good treatment?
Well, it's super important. So you mentioned L-form bacteria. One of my colleagues here in the St. George area has done a lot of groundbreaking work on L-form bacteria. And if folks don't really understand what that means, it basically, L-form means they're cell wall deficient form. So we've got video literally where you can put these microbes. When they first discovered it, they discovered it with tuberculosis. And they thought for a lot of years it was the only bacteria that could do this. Well, in the presence of antibiotics, immune cells coming around, different stressors on these microbes, they'll literally drop their cell walls and they go into what they call their L form. And so at this point now, the cell wall attacking antibiotics have no effect on them. And then the immune system can literally not see them because their outer surface proteins are no longer present. So when folks are dealing with chronic illness, I can't stress enough that you have to have somebody who not only understands how these microbes function in their standard form, but you need to have somebody that really understands how to deal with them when they're in their L form. And then after the L form stuff, then you got to move into cell danger response, which I got a colleague here in St. George. His name's Dr. Werner Vosloo. He is a naturopathic, homeopathic doctor, and he understands cell danger response better than one of my friends that's a molecular biologist that has a PhD in this area. Those are the two things that I think really get missed, and I think they're the reason behind chronic Lyme disease. Like the Lyme, where if you're on antibiotics, you feel great. A year after the fact, you're still doing good, and then all of a sudden a divorce will happen. Some sort of physical problem will happen in the body. Mine happened to be a concussion, and then it's going to kick off this storm of disease and illness. And so finding somebody that really, really, really understands these bugs at their simplest form I think is one of the best ways to get through it.
Yeah, I think the problem is really, I wish there were tests to determine, okay, where is somebody, because these things hide not only in tissue, but in joints and in organs. And then, how is it that we're going to move forward? I find it very difficult, understanding it is not an easy disease to treat, especially if it's gone on for a long time. It's devastating. And when speaking to the conventional medical community, they are adamant that it's a bacteria and that antibiotics at any given time will take care of it. And
Right.
I'm sure we both know, along with many people listening, that that's not always the case.
Right.
And
And see, sorry to cut you off. But
no,
with
that's
L-form
fine.
bacteria, the second that antibiotics enter into the system, they literally go into that cell wall deficient form, and they'll just wait. One of the best examples of this is with folks with reoccurring UTIs, right? They'll be on antibiotics for a month or two. They all of a sudden, oh, I feel great. There's no pain. There's no inflammation. But 3 to 4 weeks after they get off those antibiotics, they start to have symptoms again. They go back in and get tested again. And, well, we have the same E. coli here again. And they go, where am I being exposed to this again? How am I catching this again? You're not catching it again. When you were on the antibiotics, they went into the L form. And when you got off of it, they grew their cell walls back and started ravaging the body again. And this is one reason why these bugs are missed on so many tests, because not only will they not grow in a normal culture medium, your body won't make antibodies against them anymore when they're in their L form. And then the DNA slightly changes. So if you do a PCR test, it's going to come back, no, there's something similar here, but it's not the exact DNA, so it must not be that bug. And so that's why they're so hard to not only detect, but to deal with.
Wow. That's horrific. And where I find to be one of the saddest are people who show up and they have severe neurologic issues, like we were talking about in the very beginning here, because you just got to wonder, how in the world are we going to get that inflammation to be suppressed in the brain?
Right. Yeah. That's one of the hardest things to do. And, I haven't talked about this much, but when I got at my worst with my illness, there were a few times that I heard things that weren't really there, but it was the same as you and I having this conversation right now. And then when I started doing the hyperbaric oxygen therapy and wiping out that inflammation in my brain, it never came back. But then all the thoughts come in, how many folks are sitting in psych wards? How many folks are, living under underpasses somewhere because they're deemed that they're crazy, that they're schizophrenic, but they're having those symptoms, but it's because there's runaway inflammation in the brain from something potentially like, Lyme infections, or the Bartonellas are known for the big problems in the brain, or any other infection that may do it. And all it would take is some antibiotics and something to eliminate the inflammation, and those folks might get their lives back.
So, when you were being treated, I guess I'm missing a link of how you got into the hyperbaric treatment for yourself. Maybe I missed the link, but how did that happen? You must have gone on the path like we all have and trying different things to make yourself feel better.
Yeah. So I did a lot of things out of the gate. But one thing I really noticed was having a background with the bugs and things like that is it shouldn't take that many antibiotics to eliminate an infection unless there is something else going on behind the scenes. So when I first got my diagnosis, I jumped into the books and started studying nutrition and what these bugs would take away from us, because I knew looking under my microscope that my white blood cells weren't healthy. They weren't functioning the way they should. They weren't moving the way they should. So I really focused on putting those nutrients in my body to turn back on my immune cells to be as effective as they possibly could be. And after 2 or 3 years and a few antibiotics, I didn't take many, I got about to 70%. And then I kind of hit this plateau that I could not get over. And that's when a friend of mine said, hey, I've got a hyperbaric chamber. I'm using it to help with the aches and pains in my body. Maybe you should try this. And then I jumped into the research, and then all the lights started clicking on. Did about 30 to 40 sessions in a month's time. And my health just skyrocketed from there. So I had the building blocks in place. I had the bugs under control somewhat. I had my immune cells finally moving through my blood the way they should and acting the way they should. And then the hyperbaric oxygen therapy was just the catalyst to catapult my body back into health.
Do people have coverage through insurance to have treatments with you?
No. So the FDA really has a stranglehold on hyperbaric oxygen therapy right now. There's about 11 things that they will allow insurance to cover for. And there are things like, diving accidents where you get the bans, certain types of out of control infections from like flesh-eating bacteria, burn victims, things like that. Carbon monoxide poisoning. It's the scope of what they allow is so very, very small, even though there are studies that are a mile long showing that hyperbarics is amazing for everything from cancers to chronic illness to autoimmune GI issues. That's one of the ones that is so overwhelming the scientific evidence, but yet that no insurance companies will cover it.
Yeah, that's another discussion, isn't it?
Yeah, that's a discussion we could go on for hours probably.
Oh wow, yeah.
It's always that 300-pound gorilla in the room that we all know it's
Yeah.
there, but we don't know what to do about it.
Yeah. It's difficult. It's sad, and people really need to really put the emphasis on where they want to be in a period of time. It's hard for people to spend out of pocket. It really is. In my new practice, people pay out of pocket. And, I think my biggest analogy is about a car, that we spend more money, more time, more energy, and more effort making sure our car runs perfectly so that it's dependable. But we don't do the same for ourselves. We really don't, I'm hungry.
I love that analogy. That's a really good analogy.
Yeah. Oh, I'm hungry. Look, I'm just going to go through the drive-through this one time.
Yeah.
This one time. I'm just going to eat gluten this one time.
Right.
This one time.
Yeah, exactly. I'll put premium, fuel in my car every single time, full synthetic oil changes. But, tonight I'm going to go out, have a couple drinks, then end up at McDonald's, get 2 hours of sleep and go to work. And then I'm going to pay for it for the next 10 days.
Yeah.
That's
I don't know about you, but I have to play by the rules, I mean, I don't know if I'll ever be, this high energetic person like I used to be. And, it's funny because some people who really don't understand this whole concept of things that really have caused, a multitude of inflammation in your body, they're like, it's just because you're getting older.
Oh, yeah. God, I hate that excuse too. Oh, I'm just getting old. Well, it's funny that you mentioned gluten because I had never had a problem with gluten until I got my concussion. And one of my first symptoms that showed up after my concussion was just this unbelievable pain through the middle of my upper back up into my neck. And I got diagnosed with fibromyalgia from it. And when I delved into the research, I read one article talking about how after major concussions, our bodies can start producing antibodies against food that it never did before. And I quit the gluten, and 2 weeks later, the fibromyalgia was completely gone. I never had a problem with my GI system, nothing. It was all manifesting in this widespread pain throughout my body. And still to this day, even though it's 11, 12 years ago, if I get any gluten accidentally, or if I cave one day and stop and get a donut from the local market, I'll get that pain right between my shoulder blades and start to get warm. And that never, ever, ever happened until that concussion. And
My trigger is gluten for sure. But my biggest, well, you know what? I think it's because there was multiple, I was using coconut milk, and coconut puts me in a tailspin. And you know what? The worst part of this, it's not the stove analysis. You put your hand on the stove, it's hot, you pull it off. So you stop. You know, it takes people days. And if they don't really, you're shaking your head. Yes, 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 yes. Because you know what I'm talking about. If you aren't aware of these repetitive episodes, then you're going to be inflamed. And
it's that thing where folks are like with, they say, well, I eat and I feel fine, you know, well, that's the difference between the IgE antibodies and the IgG. You know, if it's not that anaphylactic style IgE, oh, I just ate something, I'm itching, people think, oh, the food doesn't affect me. But when you go pull blood out of the vein and you look for those IgG, those more food intolerant antibodies, that's where a lot of these secrets lie.
Right. And you know, one of the things that I learned more recently is that people who eat specific foods, now they may not even know this particular food, but end up having like some heart palpitations or whatnot, is actually a symptom of having some food intolerances. And
absolutely.
Yeah. So I guess people just need to be aware, you know, and that's where that, write down everything you eat, write down all your symptoms for a period of time. And it might actually open up some light, you know, to what you need to do. You know, it's so funny because we have the people who don't understand and are learning. We have the people who are spending gobs of money to take care of their car. And then we have the people that want to feel better, but won't take the time and energy to do it. Yeah. So here's the best. So I have a younger woman. She's got metabolic syndrome. She has gut issues. She's got headaches. I mean, I can go on and on and on. And so we went through all of the stuff about her diet and what she needs to do. And I'm like, here's the beginning. This is where we're going to start. You know, we'll work into this. I can't tell you don't. But do you understand what I'm saying? How we're going to begin to eat clean, and we're going to work on whole foods and things like that. So anyways, it was the end of the day. She leaves. I go by her. She's on the phone ordering fried egg rolls.
Wow.
God. I go, my God, did you not hear me? This is the last time I'm going to do it. I'm like, okay, let's see about that.
Yeah.
Unbelievable.
Yeah, well, that's what we deal with out here too. I mean, that is the one thing. And I tell folks, you know, sometimes when folks roll through my doors, they've been everywhere, saw many different doctors. They'll even get into the, you know, energy healing, which I think is super important as well. But the folks that have already taken the steps to get the diet under control and to, you know, take those pro-inflammatory foods and things out of their life are already so far ahead of the game. And then I'll have the individuals who will spend tens of thousands of dollars for IV infusions and stem cells, and they'll buy their own hyperbaric chambers, but then they'll head over to their local fast food store and get a number 4 and supersize it, and then be like, well, I'm doing a lot better, but I'm stuck and I can't go any farther. Mm-hmm. Food is such an issue for folks.
Well, here's a great thing. Food is medicine, right? We know that. But it's also what you not only eat, but what you're able to break down and absorb, and what your body can utilize. And not having the important, all-time important recipe for that. You know, some people, again, are doing part of it, but not all of it. I think people just have to commit. They really have to commit. It's just like quitting smoking for some people. I mean, some of these foods are truly addictive.
Oh, yeah. Yeah. I mean, glutens break down into a substance, a protein that's very similar to opioids. So, I mean, quitting gluten, I thought I was going to die. It was literally harder than anything I've ever done in my life, giving that up. Because when I was younger, man, it was dinner rolls, everything I could have with the breads was my thing. And to
Yeah.
give that up, but I had a situation where, okay, chronic pain or no gluten, take your pick. So I was put into a corner where I really had to choose a no gluten. But some folks that aren't as reactive as I am to it don't really quite understand the systemic inflammation process that they're kicking off in their body every time they do what they do.
They do. They do. And, I think people need to understand that genetically, there are people that produce a certain substance. It's called zonulin.
Yeah.
The people who produce a tremendous amount of it are those that have celiac disease and cannot tolerate any gluten, any wheat product. But we all produce this zonulin. And zonulin is responsible for kind of opening up those little tiny areas within the intestine. And then you have bacteria that flows through into your bloodstream. You have food particles that flow through. And in the presence of gluten, your zonulin level will increase. Everybody's does that. And so if you think about it, you've got a piece of carrot floating around your blood, your body is going to say, hey, this carrot doesn't belong here. And that's where it starts triggering the inflammatory response.
Yeah, I mean, having done lifestyle analysis for 12 years, I can look at somebody's blood and 95% of the time I can tell if they're eating things that they're not breaking down well, just by the way the red blood cells are clumping together. And this is spot on. I always have them fast for 2 hours before they come in. And when we bring that slide online and look at it, if we see that stacking of the red blood cells, or it's called rouleau, you're eating something that your body's not breaking down. And what it's causing is your immune system to key in on those. And a lot of the inflammatory problems that some of these folks have starts right there.
Wow. That's really interesting. I want to go back to the chamber themselves, because you were the one that actually told me that the large one that you lie down in, there's other options. Can you describe the other option that you sit in?
Right. Yeah. So there's actually two different forms of hyperbaric oxygen therapy. There's the high pressure hyperbarics, which you'll find these chambers, at your hospitals and things like that. Usually made out of metal. They can usually sit between 4 to 12 people inside of them, and they can put you under extreme amounts of pressure. And now that extreme pressure is really good in certain circumstances. So, healing up wounds will do it a lot faster than the chambers that we have, which are called mild hyperbarics. But when you're under the high pressure, there comes a lot of other side effects that can happen. And especially for folks who are dealing with neurological disorders, the high pressure hyperbarics absolutely are not the way to go. The mild hyperbarics, which we have, are so much more gentle, and they really, really rebuild that neurological function a lot faster than the high pressure ones.
Wow. But you were the one that told me that they have the ones that, instead of lying down feeling more claustrophobic, there are the kind that you actually get in and you sit.
Yes. So we have two different styles at our office and that we sell and we rent. You've got the standard lay down ones that look like a big tube, they're actually very comfortable gel foam mattresses, but to the claustrophobic mind, they get in there and they think, I'm in my tomb, I'm laying down. Then we got our other style, which are our vertical chambers, and you can sit upright in those. So you can sit in there in a very comfortable chair. People that are business professionals will come in during the day, get in these hyperbaric chambers, take their laptop in there, do whatever work they need done while they're healing their body. So it's a really, really cool dynamic where we can offer, both types of hyperbaric chambers to individuals.
So, you can do just about anything in there, meaning you can work on your cell phone, you can use your tablet. Is there anything that you can't utilize within that? I mean, it air, oxygenation is not going to ruin too much, right?
Right. No, it's not. Well, I mean, the main thing is you can't have anything that could produce a spark because, fire and oxygen are very, very, very good friends. So
Yeah. So,
that's,
so no smoking, no smoking.
yeah. Yeah.
No
Believe it or
smoking.
not, I had a hippie individual come in a few years ago and say, "Hey, can I toke out in there? I think I could get a lot higher." And I'm like, "No, you get probably
No.
30 feet in the air higher, but we're not doing that." So that's one of the main ones. Like anything that produces a spark, you can't do. But one really cool thing we've been working with about the last 6 months is when you get in a hyperbaric environment, there's a big shift in your nervous system. So your sympathetic nervous system starts to be brought down. Your parasympathetic nervous system comes up, and there's this peaceful moment once you get to pressure. And I had to get some expensive equipment to find out exactly what was going on, but that's what was happening, the bridging of your two nervous systems. So, my mind where I always go is, okay, well, how could we utilize this better? Well, that same bridging of the nervous system is similar to when we meditate. So I got an Oculus, which is, that 3D world thing. There's guided meditation on there. You pick whether you want to be sitting on top of a mountain or down by the ocean, put on that Oculus headset, get in that hyperbaric environment, and you go to that higher place where you can work on the subconscious mind almost instantaneously when you're in there.
Okay, tell me what that is again?
So Oculus is it's a 3D virtual reality headset.
Oh, is that what they're called? Okay.
Yeah, yep. So there's
Wow.
already a program on there that's available. I'm actually working with a gentleman here in town. We're creating our own, but you're at that place where you can access the subconscious mind for past traumas and different things like that. So we're really trying to use technology with the hyperbaric technology to get people into that place where they can pull that trauma out, see it for what it is, deal with it from their logical point of view, and then start casting away that past trauma that's really holding them back.
So you really, as part of this, you need a therapist in there. You need to offer a therapist hyperbaric oxygen session. That would pull it all together.
Yeah, well, we have actually a gentleman here in town at Turning Leaf Wellness who is just, he's the Yoda of dealing with emotional scars. And so we work directly with him and his patients and some of the folks that come in to see us, because, when you're healing, it's not only the physical side of things, it's not only spiritual, but you got that emotional side as well. And so when we get patients in here that, or have had these traumas in their past, then I link them up with Dean over at Turning Leaf, and then we bring everything together with the VR and just,
wow.
take them on the journey.
Wow, you're so much further ahead than anything in Massachusetts. There's just nothing like this in Massachusetts. We're still, my sauna is still new to people, sauna therapy, explaining, near, mid, and far infrared therapy. People are like, wow. It's like, come on, guys, come on, listen to me, So
right. And that's one of the benefits of St. George. I don't know how it became this hub for really, really unbelievable doctors and scientists and everything. But a town of about 100,000 folks, we have people flying in from all over the world to come and see some of these great practitioners down here. And it's just a blessing to have them in my inner circle.
Yeah, I'm actually friends with Werner, so I've gotten to meet him and spend some time with him, and he's been on the podcast as well. And I've been using with some of my patients his products because people can actually order them on their own and have that full foundation kit, and it works pretty well. So tell me, where are you again? You're in St. George, Utah.
Yep, St. George, Utah. It's a southern tip of southern Utah. We're about 90 minutes from Las Vegas, Nevada. So when people think of Utah, they think of the towering mountains and ski resorts, and we're in the desert. We're usually 110 degrees during the summer. We have amazing winter, spring, and fall here. So it's a nice little place where we have. It's the beautiful Red Rocks is what people know it for.
Wow. Wow. Yeah. I was going to come out there and visit at one point, and I don't remember what exactly happened, but then again, trying to make plans during COVID right now, you can't go anywhere really, or you don't
Right.
feel safe enough to go anywhere. Um, so your center, what does it also encompass? For me, it sounds like you have a city for a center. It sounds like it's very large. So you do your hyperbaric. How many units do you have in your center?
We have five units here in our center now. We have a multitude of rentals. I'm not even sure how many we have out there right now. We do a lot with infrared saunas and coral therapy. We do a lot of light therapy as well.
Yep.
And then I have a nurse practitioner here that has her own practice inside my place. And she does a lot of IV therapy and different things like that. So
Mm,
I know, my little scope of what I do is a part of the puzzle, but it's not everything. And then that's why I love to reach out with folks like Warner. And we have a geneticist here in town, Dr. Jen Myers, who is just the top of the top, creme brulee when it comes to genetic stuff. And we all try to work together and provide our little part of expertise in helping these individuals along their health journey.
it's a village, right? It takes a
Yeah,
village. And
exactly.
there are multitude of aspects, I forget who said this. I think Dr. Hyman said it, that uh, genetics loads the gun, but the environment is what pulls the trigger. Do I have the right one?
You said it perfect, actually. Nice work.
Well, I wish I made it up, because it sounds like it could be very valuable, but I believe it was Dr. Mark Hyman, that I got that from. Um, so, is there any other worldly advice that you could give to the listeners today, that you think that you're talking from your heart? So tell us, is there anything that you really want to tell them?
Yeah, relating to my own struggles with Lyme and mold illness and whatnot, it's a very dark road, and there are a lot of really down times, but you just got to keep moving forward. I look back, and there were so many things that I did wrong because I didn't know, but I knew in that wrong, there were certain things where I would feel good, even if it was for an hour or two. And those little glimpses of hope kept me going until I really started to find my tracking and knowing where I needed to go next. So for chronically ill folks, there's always a promise that's there. If you do X, Y, Z, these will be your results. And you just have to keep your head down, keep pushing forward, try to keep your loved ones on your side. That's one of the hardest things for people, because they just like, oh, they're just wasting money, they're crazy, their doctor said this won't help. Follow that intelligence inside yourself, it always knows, and just don't give up.
Good. Yeah. I think that's very, very good. And, I tell people all the time that they're kind of stuck in a rut with one practitioner, and they're just kind of, it's like Groundhog Day. They go back up, they, kind of surf through what you're taking. Here's okay. And here, maybe you ought to add CoQ10, come back in
Right.
a month. And if you're stuck and you feel like you're on that little hamster wheel and you're not
Mm-hmm.
getting anywhere, then reach out, find someone in your location, or someone that does virtual medicine, and find that person that's going to take care of you. I kept thinking every new practitioner that I was seeing, when I didn't know what was wrong, that first visit, that's the person. They're going to figure this out. They're going to take care of me. And then it was devastation after that, because it
Right.
just didn't happen. And so taking that little bit of information and still remembering that was a trauma for me. No one was taking care of me.
Right.
I now make sure whoever I am taking care of, that I'm there for them completely. And if I don't know, I find out. And if I can't find out, then I refer somebody to someone else that has more skill than myself. I never waste people's time, energy, or
Right.
money. It's just not worth it. because my ultimate goal is to make them feel better. And if I'm not doing that, then I need to find out either why. Is it them, or is it the wrong avenue, or is it just that they have something more that I can't take care of at this point? What do you think about
Right,
that?
and that's the beautiful thing about being a alternative health practitioner and being a healthy one, is that we know what we know and we know where our specialties are. And when people are getting stuck in these ruts, it's not that, oh, we just have to keep forcing what we're doing down their throat. We have to have that intellectual honesty to go, okay, I've done what my specialty can do for you to this point. Let me get you in touch with this person, that person. And it is amazing. The first time that somebody ever did that to me, it really made me feel like I was a whole individual again, and I just wasn't some number that was bringing dollars and throwing them on the counter. When you knew that a practitioner actually cared that you got better and was strong enough to admit that, okay, I need to have you go up chain from me, that gives you all the hope in the world.
Right. And truly someone that I take health and I put it in terms of pillars. So I don't just look at you and your herbs. I look at, are you detoxifying? What is your nutrition? How can I help you sleep better? How can I help you poop better? We all know pooping is so good. And how do I help you lower your stress? I can't do that. I
Right.
can't do that, but I have to help you do that and teach you how to do that. And then, one of the things I learned through all of my education is that if you explain it, and sometimes you have to explain it so simple,
Right.
and the person then understands how and why, they're more likely to continue with your treatment regimen, and as well ask questions because they're not intimidated. They're not afraid to ask, okay, I don't understand this, explain this again. And I love to use analogies. I think analogies are great. Some are really goofy and silly, but I think most of the time it serves its purpose.
Yeah. Oh yeah. I mean, any way that you can get that light bulb to click on in a patient's head is a beautiful time. And we all learn differently. We all think of things in our, through our own past experiences and whatnot. And I think to add what you're saying there, I think as a practitioner that we have this, thing we owe to our patients where we need to stay on the cutting edge of the science that's coming out. And that's why, like when Werner Boslow showed up here in St. George, when he told me about cell danger response, all the lights clicked on in my head. I had something I'd seen under my microscopes for about 10 years. I could not get an answer out of anybody of what I was looking at. I went to meet with him the first time. I said, tell me what this is, and I will, be a colleague of yours forever. And he immediately knew what it was. And that's the beauty in people who keep on that cutting edge of the new science that's coming out. We have our busy lives, we have our families, we have everything we've got to do, and all these parts of us that we got to fulfill. But at nighttime, we get on. Let's stay on top of that science, because there might be some science that comes out that clicks in your head. Oh, this patient here, this is what they need.
Great. I can't thank you enough, Ryan. This has been so informative, and I would love to learn and actually utilize hyperbaric treatment sometime in the future. So for all you people who've been listening and you're part of my life on a regular basis, I thank you for listening to the podcast, Living with Lyme. And I'd love for you to visit my professional website at www.pursuewellness.us. Maybe we can help you here as well. And for Ryan, his contact information will be in his bio. And if you're out in St. George, do stop by and see him. He would probably love to see you. For everybody, make it a good one. Take care.